Let's talk about some directions and some planes of section. So first of all, we need a common frame of reference for anything that we do when we describe anatomical features or parts of the body. We need to be able to relate one part of the body to another in such a way that it's consistent throughout our descriptions. So like a system of reference like north, south, east, and west, so forth, we need a system, a coordinate frame of reference when we refer to the body. Now we have, for example, if you're lying down on your face, like this guy, you're lying prone. If you're lying this way, you're lying supine. And if you think about supine, if your hand is supine, your palm is facing forward, or if I'm flexing my elbow, my palm is facing upwards. Now, we can talk a little bit about the directions on the human body, and for that I will need my model. And we have a handy-dandy model here. This is a retired school teacher and a neighbor of mine who has volunteered to help me with his demonstration. Let me stand a little bit further back. He is assuming the anatomical position. Notice he is looking straight forward. He is standing with his palms out by his side, facing forward, and his thumbs are laterally or facing away from his body. His feet are facing forward, slightly apart, not completely together and not way apart, but slightly apart with his feet facing forward. And this is the anatomic position. When we look at a person in the anatomic position, we always have the same reference frame so that every part of their body will be in the same place in relation to every other part of the body. So you won't be describing somebody who's like this or whatever else. So this is how we always describe the body in the anatomical frame of reference. So we have several directions we need to know. First of all, just like north, south, east, and west, we have the superior direction, and that is assuming that your subject is standing. The superior direction is up, and in the case the patient is lying down, it is towards the head. The inferior direction is down or towards the feet. Now, we have, and I'll get my handy-dandy slicer here, we have the body midline. And anything towards the midline of the body is going medial, and anything going away from the body midline is going lateral. Now, we also have the front part of the body. This would be called the anterior aspect of the body. Now, if our subject turns around, we have the posterior aspect of the body. And I'll turn a little sideways here. So anything coming this way is posterior. Anything in that direction is anterior. Now, we can also use terminology like cephalic. Remember our anatomical regions. The head region is the cephalic region. This could also be the cranial region. Anything towards the head is the cranial or cephalic direction. Anything towards the tail is towards the caudal direction, and cauda means tail in Latin, and it's towards the coccyx in the human being. Now, we also need to know that you have, for example, proximal versus distal. Now, proximal is anything that's attached to the trunk. So here we have a shoulder, and the shoulder is attached to the trunk, and it is proximal. But as we move out away from the shoulder along the arm, we are going more distally along the arm. So the elbow joint here is distal to the shoulder joint. The wrist joint is distal to the elbow joint because we're moving farther and farther away from the trunk of the body along this arm. So as we move back up, we would say that the elbow joint is proximal to the wrist joint, and the shoulder joint is proximal to the elbow joint. And the same is true of the legs and the hips. So the hip is proximal. The knee here would be distal to the hip, and the ankle would be distal to the knee. And as we move back up, the knee would be proximal to the ankle, and the hip proximal to the knee. And so we can use these anatomical directions to describe where things are. For example, the nose is anterior on the face to the ear. You could say that the occipital part of the head is posterior to the ear. You would say that the chest is inferior to the chin. you would say that the pelvic region is inferior to the chest and to the abdomen. You would say that the pelvic region is superior to the feet. Now we also call the anterior aspect the ventral aspect. So in the human, the ventral and anterior aspect pretty much means the same thing. Likewise, the posterior and dorsal, the dorsum being the back, the dorsal and posterior aspects are the same thing. If you think of the dorsal fin of a shark or a dolphin sticking up out of the water, that is the fin that is located on the back of the animal. However, when we think about an animal such as a cat, or a dog, or anything that is on all fours, we have a slightly different arrangement. The head is now anterior, the tail is posterior, the back is now superior, and the belly, or the ventral area, is now inferior. And so those are slight differences that we need to know when talking about the coordinate reference frame for the human versus, say, the cat when we work on our cat dissections. Now, you can follow along. I believe this is page 15 and 16 in case I missed something. But not only do we have our anatomical directions, we also have anatomical planes of section. So, the body midline, also called the median, would slice the body if I were to go right through here into left and right hemispheres. This is what we would call the Midsagittal Plane. Now, this is the long axis of the body. And you could slice this person into two halves, left and right halves, right along the long axis, or we could turn him sideways and slice him front to back, right down the long axis, and that would be the frontal plane, because it would be separating the front half of the body from the back half of the body. We could also slice our person this way, and we could slice anywhere along here. And that would be called a transverse plane, because we're taking a section, a cross section of the person in that direction. So we have what we call the sagittal plane. On the midline would be the midsagittal plane, and I'll actually show some pictures of these in lab when I can show you some actual MRI and CT scans that are in these different planes of section. But as we step laterally to the side, either left or right, we can still section this way, and we could see a section through here, for example, and what you would see if you section through here is you would see his body in profile, because you would be sectioning, you'd be pulling away the right half of the body to see part of the left half of the body in here. Let's just say I sectioned him right down the midline, like this. Then you would see his body in profile from his pelvis up to the top of his head. Now, if I were to section him this way, you would see a cross section right through his body, and you would see the profile of his frontal section here. So the frontal section, this would be a frontal section, and the frontal section is also interchangeably used with the word coronal section. And a coronal section comes from the term of the head, when you think of a corona or a crown around the head. So anytime we refer to an image, especially of the head, it's usually referred to in the coronal section, not always, but typically any image in the frontal plane of the head will be called a coronal section. The body, it can be called coronal or frontal section. Less often you'll be seeing it referred to as a frontal section of the head, but typically, because you can think of corona around the head, frontal and coronal are interchangeable. You can also remember that by the frontal area of the body being the forehead. And so that's sort of a quick introduction to our anatomical directions and our anatomical planes of section. And during lab, we'll look at some actual images that are taken in these different anatomical sections, planes of section. Thank you.